From NBC News, this is Today with Matt Lauer and Meredith Vieira.
We are back at 8:10. She was a beautiful teenager with a bright future in front of her, but when she went under the knife for a cosmetic procedure, things went very wrong. Here's NBC's Mark Potter.
To her friends, 18-year-old Stephanie Kuleba was known as Sunshine, a bubbly high school cheerleading captain with spectacular grades, bound for medical school.
She was just that kind of girl that everyone loved, and everyone just, there was like nothing bad about her.
Last weekend, Stephanie went to an outpatient center in Boca Raton, Florida, for cosmetic breast surgery. During the procedure, she suffered an extremely rare reaction to anesthesia and died. Doctors say it was likely a condition known as malignant hypothermia, where the body's metabolism runs out of control.
And then that follows shortly thereafter with elevated body temperatures and release of salts into your bloodstream that shouldn't be there, and that leads to a crash of your metabolic system.
As family and friends mourned, there were many questions about whether the condition could have been detected before surgery.
What the family wants primarily, first and foremost, is to investigate this matter, to get some independent medical opinions as to why she died, to make a determination if this is something that could have been prevented.
Doctors say Stephanie's condition was so unusual, patients are rarely tested for it. And when malignant hyperthermia sets in, they say, it's hard to stop, especially in a small clinic.
When the temperature is going through the roof, when the heart is failing, it's very difficult to turn your attention away from the patient in order to actually mix up the antidote.
A genetic defect, the likely culprit in the tragic death of a young woman who seemed to have it all.
Just knowing the kind of person she is and the kind of shining star she was, it's just really sad.
For Today, Mark Potter, NBC News, Miami.
Dr. Richard D'Amico is president of the American Society of Plastic Surgeons. Hi, doctor. Welcome back.
Good
to see you.
Thank you, Matt.
Malignant hypothermia. I've never even heard of it. You, though, as a surgeon, saw a case of it.
Yes, indeed. But, Matt, the first thing I want to say is that this young lady's death is a tragedy, and our hearts go out to her family. It's a devastating event. Having said that, we have experience with this problem, this malignant hyperthermia. This is something that can happen in any surgery, on any part of the body, in any setting.
What happened when this male patient you were operating on developed this?
He was having uncomplicated nasal surgery, and during the surgery, my anesthesiologist noted some changes that she felt were suspicious, and heart rate went up and body temperature suddenly shot up, and she instantly made the diagnosis. And there's a medication for this, which you need to give the patient very quickly. It was done. And Dr. Marcia Thornhill, my anesthesiologist, helped to save this boy's life.
Now, is there any test? Is there a way? Did you have any indication, any clue that this patient had this genetic condition before the surgery?
No, and most often there isn't a clue. This tends to run in families, certain families, and we ask about family history, but often it's negative. The genetics here are very complicated, and the only test to predict it you would have to cut out some muscle from the leg, and there's only 5 places in America to do that.
You did mention to me in the commercial break, though, that age might play a role in this because this can happen in a first surgery with someone. You find out about it with your first surgery.
Exactly. The body reacts in a very rare but very devastating way to very common, very useful anesthetics.
Let's make a turn then here, and let's say that this is another element of risk in a surgical procedure.
Yes.
So when you hear about these 18-year-olds, and this was corrective surgery she was going in for. This was not traditional breast augmentation. But when you do hear the numbers of young ladies, 18 years old, in that area, jumping, these girls getting breast augmentation surgery, how do you deal with it?
Well, let's first separate what happened here was an anesthesia problem and could have been any surgery. But the question is a very reasonable one as to why young women want breast surgery, and I think that the development of the breast is a very sensitive issue to young women, and it's something that's important to them. So our job and what we stay up at night doing is trying to minimize the risk if these adult young women, and we feel they should be 18 years of age. The FDA feels the same way, that they should be at the age of maturity to make this decision. Our job is to minimize their risk if they're going to do that. And that, I think, is the important lesson here for young women, for their families, is to seek out a board-certified plastic surgeon, have their surgery at an accredited facility, and have a good preoperative workup. Nonetheless, there's never no risk.
And never 100% certainty.
Correct. Our job is to minimize that risk, and we stay up real late to do that.
Dr. Richard D'Amico. Doctor, thanks for your insight on this. I appreciate it.
Great. Thank you, Matt.